All right. So let's talk about your spine, and let's actually talk about like what you're dealing with likely. So you definitely have overlapping symptoms, and what does that mean? It means that you're having tension and discomfort like right through here. You're having tension, discomfort right through those muscles right through here. You are also getting some of those symptoms that go down into that way. In your case, you told me physically, or you told me that like you're having some symptoms that wrap around into the thighs or into the legs, going down that way and that way, maybe even down into the leg at that point. Now you told me a little bit like sometimes on the foot, right? Did you say was it the bottom of the foot?
Yeah.
Yeah. So, was it on both sides?
Yeah.
Okay. So both sides, bottom of the feet, coming up and stuff like that. What I'm noticing with that type of condition and stuff like that is like if you're having numbness and tingling, you're gonna have some sort of compression to the spine, as I said.
Mm-hmm.
You're also gonna have compression to the nerves. The thing is, when I tested you, you didn't have true compression all the time. So a lot of people think like step on here's like a I'm just gonna give you an example of like here's the nerve. I'm stepping on the nerve. Okay. Now there's no water flowing that way, right?
Mm-hmm.
That's kind of like a very simplistic drawing of that. And then what that would say is like you're having compression. But in this case, you're not having true compression that occurs all the time. I tested some of the nerves. It didn't seem to compress. It just seems like when we put you in some certain situations, certain areas of that spine, then it would irritate it, and then you would possibly feel those symptoms later. Thing is, right now, I would probably have to do that over and over and over again to you because your body's fairly resilient at this point, and I can see why you're probably flaring up, and we'll talk about that in a second. So let's talk about tightness, tension, nerves, and stuff like that. So I did a few tests. First things first, I want to let you know that weird test that I said that's going to be the weirdest test where you have to lift your butt up and everything. That was a prone stability test to tell me if you're having stability in the spine. That means that they're not shifting too much and things are treatable. That means like I can go ahead and adjust you if we want, and that means I'm not worrying about other pictures and like getting you imaging or x-rays at this point in time.
And that looked okay.
Yeah.
Okay.
So I do want to cap on piriformis syndrome and why most of the time it's not, because like here's the piriformis, right?
Mm-hmm.
This is the piriformis muscle. Okay? Right underneath that piriformis muscle is punching you, the sciatic nerve.
Mm-hmm.
And so some people will be like, "Oh, I'm having piriformis syndrome that's giving me symptoms that go down into the leg because that muscle or that piriformis is too tight." So what people will do is roll out this piriformis as hard as they can, try to release the tension, and that sometimes does help symptom relief. But if we kind of draw this back up, and I'm going to just get rid of the muscles real quick. I'm actually going to get rid of the bones. Actually, I'm not going to get rid of the bones real quick. I'm going to get rid of some stuff so you can kind of see. If we follow this all the way back, this sciatica or this sciatic nerve is a branch of multiple L4, 5, 6, 7, or sorry, L4, L5, S1, 2, 3. Those direct nerves. So if you have an irritation to one or several of those nerves, what we're going to do is we're going to get irritation of that sciatic nerve, and a lot of times we'll feel it right here at the combination right where it kind of comes to, right?
Yeah.
So a lot of people will think it's sciatica or piriformis syndrome when it's actually a nerve root irritation. So a nerve root irritation just means that it's being irritated closer to the spine.
Okay.
That's it. So that's really all of it. And the way I view nerves is just a superhighway.
Mm-hmm.
And that superhighway can branch into multiple areas. And so that's why you can have multiple symptoms sometimes. Yeah. And in your case, I think your body's just compensating, and we haven't found that quote perfect neutral spine. And what you said was perfect actually. Like, and you don't even realize you said it. You feel like it's not stable enough to go through a range of motion.
Yeah.
It's perfect.
Like if I were to deadlift right now.
No, because it's not stable to go through that motion.
Yeah.
So what happens when the spine can't support its own structure, right? Essentially when it's not stable enough to go... Now it's stable, by the way. It's just not strong enough to go through that mobility, right? Well, other structures have to pick up the slack. That's the muscles. That's the tension that you're feeling on both sides. So oftentimes when people have I'm just going to do that so it re-adds tension through or compression to that nerve or to that disc or to that area. They will get these muscles around the spine to start guarding. Remember we said there's always a reason for tightness. That sensation. Your muscles are guarding and protecting it from further injury. The problem is we haven't been able to find out what helps it, what hurts it. You haven't. And in your case, so most people actually have problems more so going forward.
Uh-huh.
We call that a flexion preference. We prefer to go forward.
Okay.
Most people have a flexion intolerance, meaning they prefer not to go forward.
Oh.
You actually have a preference to go forward.
Oh.
So most of my prescriptions for most people is actually to do those extensions.
Oh, okay.
Your case, I did that out there with you. It shot the bed. It was not good for you. We tried multiple times. We tried again, and then we tried again, and it still caused some problems. However, remember we went to the lowest level? It didn't cause any problems. So some extension is good for you. Too much is not. Some flexion was good for you. Too much wasn't either. You just had way more range to go forward.
Mm-hmm.
So imagine if I had you go into a deadlift like this, you probably, and just go through this range, you'd probably be okay.
Mm-hmm.
But to actually go through the deadlift, it's too much of a variability on the spine at this point in time. So I think you're gonna need some good amount of rehab in your spine for sure, and like there's some things that we'll talk about and stuff like that. And this is why I don't think that adjustment only will fix you, and I don't think muscle only will fix you. I think you're gonna need to add that component. I will give you some of those skills and tools necessary.
Okay.
When I did that weird adjustment where I was testing your pelvis, that was actually to test irritation in the SI joint. And that's why I was like, did you feel it more here or did you feel it more here? Here or
I guess
here?
it's so hard to, like, right in the middle of those. It's kind of like where I felt it. It was kind of hard to determine.
I was just going to say
where...
that. So you're really in tune with your body, I can tell. And that's really awesome because look at how darn close these two are to each other. Why do you think so many people, when you Google things, I like patients to Google things, but also I also tell them just be mindful that it's probably not right because it's so generalistic and every website has to have a disclaimer that's hidden, you don't see it.
So come see a professional. Like
Yeah.
you.
So what happens is that if you think about this, is that like these nerve roots really just come right out and they go down into the leg. So what if you didn't feel the nerve root there, but you felt the pain there? And you can just say, oh, it's piriformis syndrome. Oh, it's SI joint problems. These things tend to overlap.
Mm-hmm.
I tested a lot of your spine. Remember that one where it went like this?
Yeah.
And like that's a lot of strain on the spine. It's a ton of strain on the spine. It's a ton of strain on the neck. But when you looked up, it actually relieved the pain.
Mm-hmm.
So that's like pulling a string. Excuse me if I do that. From here, and it's pulling it on this side.
Oh, okay.
And then I'm pulling the string on this side. And it's pulling on this side. So I'm literally pulling at both ends, and then when I release one end, I look up, it actually releases the tension in the spine. That's called it's like a spinal neural tension test to see how much tension is going on in the spine. You had moderate amount. Some people will light up like a Christmas tree before I even get halfway through.
Oh, okay.
So I'm not that worried about like it being true blown sciatica. Why do I think you've had like this huge flare-up is because we haven't been able to find what helps you and what hurts you. And now that you know, like we need to figure out like, so what I call it reducing insults. We have to reduce the things that are problematic for you because no matter how good I am or how good someone else is, whether you see me again or not, it doesn't really matter. No matter how good your rehab program is, if you don't stop pissing it off, it's not going to get better.
Okay.
So we need to realize that too much extension, meaning carrying your kid, because carrying your kid is like this.
Mm-hmm.
It's too much extension. Too much flexion is the extremes of what you need to stay away from right now. You need to operate within this barrier. And how do I know what that barrier is? I don't. How will you? Symptoms.
Okay.
So I can tell you right off the bat, for sure, if I were you, like definitely don't stretch your hamstrings because that's the same darn thing as this.
Okay.
Right? And that irritated your symptoms. You could roll out if you wanted to for just mobility's sake and just to help symptoms. But I can almost bet you that if you just did 3 to 5 straight days of watching your position and posture and not going through that, you're going to probably reduce your pain about 10%.
Okay.
Just by watching your posture and watching your positioning. That doesn't mean don't operate, but that means like, if you need to go down and see your son, you don't pick him up from the bottom, you actually squat down, get on your knee, come up, and then deal with that and do it almost like a robot.
Okay.
So I think that will make it a little bit different. Let's talk about. So I just want to show you some other things, like, if we have irritation to like the sciatic nerve, whether it's at the piriformis, so to speak, right, the piriformis, or at the nerve root or the spine, we can have symptoms that go down into the leg. We have branches that all the way go that can go down, and that you can see how they can go underneath and course through this tunnel here down into the foot. One thing that I don't want to say concerns me yet, because you're not really showing signs or something, is that you're having it down both sides. If it continues that way or gets worse, I definitely need to know immediately.
The tingling, or just like the...
Because when symptoms go down to both sides, we think locally. We think at the source, centrally. Because, right, think about... Let's get rid of the... So, if you had one main line that branched out to two different lines, and you had symptoms going down both sides, where do you think the problem would be, right? It would be in the center. So when something's going on centrally, we need to think about that. And we need to make sure that we're taking the proper precaution, because there are definitely things that can happen, like disc bulges, disc herniations, and but you're young, and it's like, I'm not concerned yet, and you still have the strength. So I'm not too worried, but I definitely want to make sure that you're not getting worse first. Because what we can have is what we call spinal canal stenosis, meaning it gets smaller and smaller. We want to make sure that that's not an issue for you. I don't think it is. I did some testing on you already, something that you maybe unaware of during the time. You didn't come up positive with any of that stuff. Okay. You're too young for that anyway, by the way, most of the time. Okay. And I asked some of the history questions. I said, did you have that flexibility issue? Were you overly hyper flexible? I've asked you some questions that you probably don't even...
I was under flexible. Yeah, I did dance, and it took me forever to get flexible.
But even in your history, I asked these questions and you didn't come up with that.
Okay.
So I'm taking everything from what you told me from the phone chat to all the way to this moment into consideration. So I just want to know that for sure, and that's why, for certain reasons, we always just point that out to you. So I just like the fact that I think that it just needs to reduce the insults right now. We could do the soft tissue work, we could do the adjustments, I could show you some rehab and stuff like that, but your best rehab is actually going to be operating within that best range of motion that is best to reduce the inflammation. You reduce the irritation, you reduce the inflammation, you reduce that other stuff, you are not going to start the day off on the wrong foot. You're going to slowly start reducing the insults, the inflammation, and then you're going to start to heal. You cannot heal if you keep pissing it off every day.
And then as far as maybe how you were talking about, if this is being guarded, your other muscles are going to take over. Is that maybe why I am getting a lot of tension in my mid-back and then my neck?
Yes, I do think that that's part of that, because remember that during that test we went down, you're like, yeah, I feel it in my mid-back. I definitely think that is part of it. Okay. Oftentimes in the mid-back and the neck, it's actually another set typically.
Oh, great.
Yeah, it's typically. The problem is when you're talking about the brain, it's really fascinating. When I punch you or you punch me really hard into the arm, and I punch you in the other arm or you punch me in the other arm, where do you feel it last, right? Mm-hmm. It's usually one part. It's usually the last one that you hit me in, because the brain is not very good at processing two pain patterns at one time. Okay. So oftentimes what people will do is they'll come in for low back pain. I'll ask how their neck is. They'll say, I'm fine. As soon as I clear up their low back, guess what happens? Yeah. Their neck starts coming back. And then I'm like, oh, I think my neck is worse. I'm like, no, your neck is always there.
You just kind of unveiled it.
Yeah, but neck pain, but because of that spinal tension test that I did on you, what we're going, if you're pulling down at this end and you're pulling up at this end, you're creating a lot of tension into the middle. Yeah. Or into the lower back, or even into the mid back, and it doesn't necessarily matter where at this point, what I'm saying is that if you have tension going on down here, and then you're going to have restrictions in guarding going on either up here or somewhere here or there. And that's how low back pain or mid back pain can cause low back pain or neck pain.
Okay.
And it's because you're literally, your tissues are not sliding and gliding as freely as they should. And that's what I need you to realize. Like, it's not about like mobility or getting more stretches. It's about like solving one little micro insult at a time. Just like, working out and lifting, heavy weight. You don't just start off with 100 pounds. You start with like, oh, let's start with our body weight and get our form, and then, oh, let's pick up a bar. How do you hold the bar? Do you hold it like this? Do you hold it like that? I mean, everybody's got different grips, right? Mm-hmm. How far wide is the grip? How far close is the grip? Where's your hand stance? Where's your foot stance? What kind of shoes are you wearing? And then you put the weight on.
Right.
So you really have to start solving one little thing at a time.
Okay.
And as you solve one of these issues, sometimes the other symptoms will go away. Sometimes it will develop into, like I said, a whole nother, like you actually realize that it's actually a whole nother issue. Okay. I find that it's usually a little bit of overlap though, because once the spine is the center of all movement, right? You can't move your arm without actually stabilizing your spine. You can't even move this without moving everything. So if you learn how to move it from here, you're going to end up feeling better. And I think that your spine is not unstable. It's just weak in the sense that if you move it too much, it feels weak.
Yeah.
Does that make sense? Like, it's not actually weak,
Yeah.
You're definitely strong, and you have the strength to show me, because I actually, if you weren't strong, you wouldn't be able to perform that test, that weird test that I showed you.
Oh, okay.
So, any questions on anything so far?
No.
No? So let's go ahead and treat you today. I'm going to slide this off so this way I can